Hi, I'm Dr. Bill Lovett from your Wellness Center. This is part 3 of a 3-part segment where the first part we really talked about symptoms of hormone replacement therapy. In part 2 we talked about how that can be accomplished. Part 3 we're really going to talk about how life can look like after you received hormone replacement therapy. There's a lot of reasons why people come in for hormone replacement therapy. Women and men usually come in sometimes for different symptoms, and sometimes they're similar actually. So it all can depend on what individual issue you're having at the time. So what happens usually about 3 to 4 weeks after we start patients on hormone replacement therapy is they usually start feeling what I usually call something. When I want to see these patients back in about 5 weeks after they've had some additional labs drawn, I want to hear back from my patients, I'm starting to feel blank. And sometimes that blank is different. I look at their complaint sheet back when they first came in and I go through it one by one. I ask them, so you complained of aches and pains, you talked about lethargy, you talked about apathy, you talked about fatigue. We talk about every one of those symptoms. And I ask them, how are you doing on this? And really what I want to hear is, I'm starting to feel maybe better in many of those complaints. I do not expect them to feel great in those complaints because as we get older, 2 things happen. One is our hormones really drop off or actually go away completely. And secondly is our binding sites in our body that bind those hormones that make us feel good when we were 18 and 20 years old just don't bind them as well either. So there's actually 2 issues here. So your labs may look pretty good when I see you in follow-up, but maybe all the sites have not bound yet. What really is really cool is when we get to see you 2 and 3 and 4 months out is when things really are actually at the peak, maybe performance for that particular beginning, and then we start readjusting. About 98% of our patients keep coming back for their hormones. This means that I have 98% of patients that are actually very satisfied with what we do here. There are occasional patients, it just does not work well for them, but that is very rare. Some of those other 2% that don't come back usually are sometimes moving to a different part of the country. So again, we really work on trying to take the individual and get them in a good spot. So what do we look for? Well, I don't expect you to be perfect. I do not expect you to be a 16 or 18-year-old, but I do try to roll you back about 10 to 15 years. So kind of think of where you are today. What would it be like to be 10 to 15 years more active or feel like you were 10 or 15 years younger than you really were today? Now, I didn't change your age is still the same, but maybe I made you have more energy. You're sleeping better. You feel like you can run around with kids and grandkids. You can do some things you haven't done for a while. You actually are noticing that you're hiking further. You're noticing that your joints don't hurt anymore. Maybe you're noticing your strength's increasing. You can do more in the gym. Or maybe now you also actually you've lost the apathy of going to the gym and now you're excited about going to the gym. All those things can happen. Okay, but you first have to make the first move. You have to get on our website, review the material, look at what we do, get on the resource tab, click on the very top tab which says consultation form, fill that out. We will call you usually within about 48 hours of business days, so usually Monday through Friday within 48 hours. If it happens on the weekends, it may take us up to Tuesday to get back to you. But then we'll start and initiate and talk to you about the program, get blood work, and then bring you in for a consultation. I tell people all the time, it is just you filling out a consultation form, getting a blood draw, coming in for a consultation. Then the decision of what you do is up to you. But at least get educated based on facts of what's going on in your body specifically. We only do individual hormone replacement therapy. We are not a franchise. We aren't some practice out there that has dug up an algorithm of exactly this is how we're going to do you every time. Every patient that comes in is very, very different. So I encourage you to call us at 513-791-9474. We'll help you through how to get into the system through the website. Or get on our website at yourwellnesscenter.com, click on the resource tab, fill out the initial consultation packet, hit submit, and then we will contact you and get the ball rolling that way. I appreciate your time. Hope these 3-part series were very helpful to you. And again, this is Dr. Bill Lovett at your Wellness Center. Thank you for your time.